Hello, good evening. My name is Kushal. I work as an occupational therapist in a neurological team in London. This is part 2 of my video series on dizziness. I explained yesterday that sometimes people feel dizzy due to a neurological condition, or if you have diabetes or elderly person. So the symptoms might be quite similar, but the causes might be very different. Today I'm going to talk about what might be the cause of dizziness for somebody who had a stroke. Yesterday I talked about when the blood pressure drops on standing. Today I'm going to talk about what causes dizziness when somebody had a stroke. If somebody had a posterior circulation stroke, that means the arteries and blood capillaries that supply the blood at the back part of the brain, if there's a stroke, it can cause dizziness. Now there might be two things again happening. One is due to the change in head position, and one is might be due to vision. So what I mean by that, sometimes after a stroke, when people turn their eye on one direction, it can be turning to the left, it can be turning to the right, or it can be turning to the both sides or up and down. It depends. You need to ask your therapist to explain what is the cause of dizziness. And if they say that it is the movement of our pupils, the balls in our eyes, if the movement of that is causing dizziness, there is two exercises I'm going to show you today that will help you to start reducing those. So please remember, these exercises are specific to dizziness caused by eye movement. Sometimes it can be head movement, and then the treatment is slightly different. So if this is your diagnosis, then two simple exercises you can do. Please do this exercise for a very small amount of time, because if you do too much, you will feel dizzy and it's most likely lead to sickness. So the exercises are, first of all, hold your hand in front of you, look at the eye, and slowly move the hand from side to side, very slowly, and keep on following with your eye. Okay, that's one movement. And the next one is where you fix the hand, you focus on the tip of the finger, and you turn your head from side to side, keeping eyes focused on the tip of the finger. Do it very gently. Do it in sitting, so that if you're feeling dizzy, you're not going to lose your balance or anything. So please try this, and if it works, please let me know. Like this, share with your followers, and I hope this video helps. But before I go, last thing I wanted to say that sometimes when you stand up, you might feel dizzy because your blood pressure might be getting high. If that is the case, you need to discuss with your doctors about what medication can be prescribed to manage your condition. So that was a question from one of my followers. That's why I thought I will answer that in this video. Thank you very much for watching. I wish you all the best.